Caring for an elderly friend or family member is an incredibly difficult task. With the advancements in medical technology, it is also a duty that affects more and more families every year. In fact, as of 2013, nearly 15% of the population in the United States was over 65. That number will only continue to grow. So what options are available to care for the elderly and disabled? The most common choices are assisted living homes and nursing homes. However, the third option of in-home care services is often the best choice for families. Here are 3 reasons why. Cost. The average assisted living facility costs around $40,000 per year. A nursing home, which provides more intensive around-the-clock care, costs roughly $60,000 per year. Most patients will split around 5 years between the 2 types of facilities. This equates to a cost of $200,000 to $300,000. On the other hand, a personal attendant makes about $30,000 per year. And when you have in-home care services, you are simply paying for the employee, and not for the facility. Easier transition. For many elderly patients, the move from their house of many years to an assisted living facility can be shocking. In some cases, it can even cause a rift amongst family members who disagree with the decision. On the other hand, the idea of having a personal attendant to help with day-to-day tasks is much easier for many people to accept. It is also a transition that can be gradual. If the patient simply needs help with running errands and performing chores a few times a week, in-home care services can help during those times. As the patient begins to need assistance more often, the amount of care can be increased as well. Recognizable environment. Another advantage of in-home care services is that the patient will not be forced to learn a new schedule or living area. By keeping people in their own houses, little mental strain is required to perform day-to-day activities. For people who have been living in the same residence for decades, it is second nature where their stationery is, how to work the shower, and how to operate the television. Placing them in a new environment, with new people, can lead to confusion and trepidation. Furthermore, familiarity with a house means there is less of a chance of a physical accident such as tripping over a chair in the dark. In conclusion, there are no easy choices when it comes to ensuring the well-being of a disabled or elderly family member. However, of the choices available, in-home care services are the least disruptive to the life of the patient, as well as being the most cost-effective.